episode of Let's Talk Natural Medicine is brought to you by Bioglan, proud platinum partners of ATMS. For over 40 years, Bioglan has delivered innovative, high-quality vitamins, supplements and superfoods, helping Australians live healthier lives. Find Bioglan at your local pharmacy today. Welcome to the very first episode of Let's Talk Natural Medicine, brought to you by the Australian Traditional Medicine Society. I'm your host, Natalie Hume, and we're thrilled to start this journey into the world of natural medicine. Here's a question. Did you know that nearly 50% of adults have tried some form of natural medicine? But how much do we really know about how it works and how it is used effectively? Today, we're setting the stage for understanding natural medicine's role in overall health and wellness. And we have the perfect guest to kick things off. Joining us is Annie Gibbins, CEO of the Australian Traditional Medicine Society. Annie, thank you so much for being here.
Thank you, Natalie. I am thrilled to help our new listeners be introduced into the incredible world of natural medicine and its potential benefits for them.
Fantastic. Well, let's get things going. Annie, let's start with the basics. What exactly is natural medicine and how does it differ to conventional approaches?
Good place to start. I think natural medicine is a broad and diverse approach to health and wellness, right? And it focuses on treating the whole person rather than simply addressing isolated symptoms. Goes into the holistic being and finds out what really is causing the issue that they're having at that time. So it draws from both traditional healing principles that have been used for centuries and modern scientific research, and it creates a well-rounded approach to healthcare. The founding nature of natural medicine, it's rooted in the idea that the body has an innate ability to heal itself when provided with the right support and conditions. That's what we often don't give that, right? We don't have the right recipe and therefore our body goes and rebels. So unlike conventional medicine, which typically uses pharmaceutical interventions or surgical procedures to manage the disease state, natural medicine emphasizes a more holistic approach that includes prevention, ideally, lifestyle adjustments and individualized care plans. So to give you a bit more of a concrete example to how natural medicine and conventional medicine might approach a common health issue, I'd probably use one called like chronic stress. In a conventional medical setting, you might receive a prescription for anti-anxiety medication or be referred to a cognitive behavioural therapist. So with these approaches, they can certainly be effective, and I'm not discounting that. But natural medicine takes a broader view by exploring multiple aspects of your lifestyle and your overall well-being. So a naturopath, for example, might assess your nutritional needs and might adapt them using some herbs or to support the body's natural stress response that is going overboard at that time. They might also guide you through stress-reducing practices such as meditation or breath work or physical activity. The goal is not only to address the symptoms of the stress, which feels like it when you're stressed, it's like take this away, but it's also to understand and manage the underlying causes. So I think one of the key differences between natural and conventional is to the emphasis on patient empowerment and collaboration, and I'm all into that, Natalie.
I love that. And so then how did you first become interested in natural medicine and what role does it play in your work at the Australian Traditional Medicine Society?
I have the most unlikely journey to this role, actually, Natalie. I grew up in a family pharmacy. My dad was a pharmacist, wanted me to be a pharmacist. There's a backstory there, but I ended up becoming a registered nurse. So once again, went medical model, and I ended up being a head teacher of nursing. And so I did Bachelor of Health Science and then Masters of Education. And then I wanted to get into business. So I have therefore been a health education CEO for the last 13 years or so. So it's a bit unusual since I've been working with doctors and surgeons for the last 15 years or so to be then CEO of the Australian Traditional Medicine Society. But my journey is really rooted in a passion for holistic healthcare and my commitment to empowering individuals to take charge really of their wellness, right? So my interest has actually been all along. I used to witness, the frustration when people have tried certain medical model treatments over and over again, or they haven't had a great outcome and they've been frustrated. And then I've seen at times very strong transformative natural therapies that have resulted in people having better experiences. So I remember a close family member struggling with chronic fatigue and digestive issues, for example. And it seemed to just go on and on despite traditional medical interventions. Like they've tried everything. And I'm sure some of our listeners are like, yes, I've gone to the doctor, I've gone to a specialist, I've tried and tried. And so watching their health improve through a combination of nutritional changes, herbal remedies, and lifestyle adjustments, it really opened my eyes up. I always were aware that there's got to be more to it. And I've seen time and time again since witnessing this family experience to so many people that I've now worked with and observed the real potential of a different approach and a different result from natural medicine. So I think now there's multiple paths to healing, I think, Natalie, and the body thrives when we address the root cause of the imbalance rather than treating just the symptoms. So while I was trained in, it's a bit of a sickness model, actually, not a health model, the traditional system. You wait till someone gets sick and then you make them well again. And my view now is, why wait till someone gets sick? How about we work more on just being well and on health promotion, and then trying to find the root cause at the earliest opportunity, because I don't want people to become sick.
And that leads me perfectly into this next question. So why do you think natural medicine is gaining popularity today? Why do you think people are turning more to natural therapies, and what makes them appealing?
I think you said in your intro, Natalie, that 50% of people are trying natural medicines, right? And that's absolutely so true. It's quite amazing. We have a natural medicine week every year, and we had more than 4 million people engaged in natural medicine. So I know that more people are seeing a natural medicine practitioner than a GP, and it might surprise people. So if that's you, as you're a listener, yeah, actually it's more common and actually is the norm. So the rise of this popularity, though, has really increased over the last few years. And I think it's related to a few interconnected factors. I think at its core, I think people really are drawn to the idea of holistic health. They want to see that the person is seeing their whole being, that practitioner is seeing their whole being, and have the opportunity to address the root cause rather than going straight to, can you help my problem? Because that problem, they know, often reoccurs and also could get much worse. They also are aware, I think, Natalie, that we're all going crazy, crazy fast, right? How many people are to say, how are you? How are you? And they go, busy, 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 busy. Everything's crazy. And this chronic pace is then resulting in chronic illnesses. Stress-related conditions are on the rise, and it's not a surprise. So I think most individuals are actually seeking a more integrative, preventative approach to their healthcare, one that looks at, if my lifestyle is going to be like that, maybe I can then have a good look at that and see what I could curb, how to keep myself balanced, how to actually keep myself well moving forward, considering, I was a mum who had 5 kids, including 2 sets of twins 2 years apart. So crazy, right? 4 kids in 26 months. It was just mental. But in that time, you can't go and say, well, just don't be busy. It was a time that I actually now look back and go, you know what? I was stressed. I was chronically fatigued. I was so sleep deprived. And it's a time that you go, yeah, you'll have these seasons in your life that things go out of whack. How do we actually, rather than waiting to have a meltdown or just can't do anything else, how do we become more self-aware? I think most people out there are saying, you know what? We are more self-aware. We are talking about our mental health, our physical health, and we want to see everything looked at holistically. I think during COVID, a lot of people actually spent that time to reassess the lifestyles and the choices that they were having. And so for a whole lot of reasons, I think it doesn't surprise me that more and more people are reaching out to the whole area of natural therapies, which is really diverse and really fascinating, and just finding ways that they can then integrate some of those approaches into their life so that they can, just feel calmer, feel more balanced, feel healthier, so that they don't want to go through the big highs and lows. They are exhausting and they're damaging on your body. Mm-hmm. How do we actually keep ourselves more on even keel? I think people are wanting that, Natalie.
This episode of Let's Talk Natural Medicine is brought to you by Bioglan, proud platinum partners of ATMS. Bioglan is your go-to pharmacy-only provider of high-quality vitamins, supplements, and superfoods. Their commitment to innovation and unique formulations has earned them a reputation for excellence in supporting health and wellness. Together, we're building a stronger, healthier future for natural medicine. Thank you, Bioglan, for your partnership and support. Let's dive into this natural medicine toolkit. So, what are some of the common therapies that people might consider when they're wanting to look for natural medicine?
There's so many, and ATMS represents 20 different modalities. So I'll just go to today, otherwise we'll run out of time. So many diverse therapies with their own unique set of benefits, and they're all about supporting the body's natural healing mechanisms and enhancing well-being, right? But some of them that are probably more common, you could think of herbal medicine that uses plant-based compounds for therapeutic purposes. Right, so herbs have been used for centuries to treat a variety of ailments, and today people are turning to herbal remedies to address everything from digestive issues to stress and immune support, for example. So a common example would be, we all know ginger might be good for anti-nausea. I was a kid who grew up with travel sickness. So I got introduced to ginger quite early. Otherwise, it was a very unpleasant car trip for everybody else. It also has great anti-inflammatory effects. Or echinacea is one that many of our listeners would be are familiar with, and that's really popular for boosting immunity. So during cold and flu season. So herbal medicines have been about providing a bioactive compound that interacts with your body systems, and it basically gently works with minimal side effects when appropriately used to help the condition that you are having. Another one might be acupuncture. And this one's rooted in traditional Chinese medicine. It involves the insertion of fine needles into specific points of the body. That might sort of worry some people. I tell you what, one of my daughters once had Bell's palsy, and so we tried all these other things, and she's sitting there with a real droopy face. We went to acupuncture. I tell you what, within a few weeks, she was right as rain. It was just amazing, and she was so grateful. She was a fan forevermore, of course. And not everyone has such instant effects. It all depends on their own body, right? But this approach looks at the flow of energy, and it promotes healing by, it's been extensively studied and recognised for its effective in things like chronic pain and such. So those people with back pain or migraines or arthritis, stress reduction, anxiety management, hormone balancing, so many different things. So obviously, I'm not a therapist. You can ask more. They're just little touching things. Nutritional therapy. Oh my goodness. Food is your fuel. Food is medicine. Good food is good medicine, right? And so there is so much value in nutritional therapists, nutritionists, dietitians, being able to help you with a diet plan that suits your lifestyle, and that can change at different stages of your life, right? I've just gone through into menopause, and I tell you what, your whole body changes, your needs change, your diet needs change. Naturopathy, it looks at that whole holistic approach of combining a variety of natural therapies such as herbal medicine, nutrition, lifestyle counseling, homeopathy. They're so amazing how they perform a thorough assessment and understand not just your physical symptoms, but also your emotional and your mental health. And I absolutely love that, because I tell you what, your mental health greatly affects your ability to be able to even manage yourself, be able to push through sometimes challenging times, to wait for the benefits, things like that. So I just love their holistic nature. And they are able to then give you a highly tailored treatment plan. So it's great for people experiencing, fatigue. They might assess your adrenal function, for example, or your stress levels, your diet, your sleep patterns, and it goes on. Big fan for mine, I'm going to finish with that, Natalie, is remedial massage. I've always been a big fan of remedial massage, and it's a real recognised natural medicine that focuses on, manipulation of your soft tissues. It releases all of that muscle tension. I get that regularly, improves circulation, promotes relaxation. I tell you what, I feel so great after a massage, even when I don't have a problem, but they always say, is there any issue that you're dealing with at the moment? So So obviously, if you've got muscle injuries, chronic pain, stress, make sure you tell them. You can also have specific massages for lymphatic flow and reducing inflammation, or specifically for relaxation. There's so many different areas. And it really has medical effects. It lowers your cortisol. It boosts your endorphins. That's why you feel great after a massage. And I love the way it makes you feel really sleepy as well.
Absolutely. That's one of my favorites as well. So, time for a quick fact or fiction segment. So, I'm going to share a common myth about natural medicine, and you tell us if it's fact or fiction. Okay, natural medicine isn't backed by science.
Oh, that is a great myth to tackle right off the bat, Natalie, in our first episode, because it's one I hear quite often, and particularly since becoming the CEO of Natural Medicine. And the answer is absolutely fiction. So while there are certain areas within natural medicine that could definitely benefit from more research, and we actually encourage that. We give out research grants from ATMS every year, and I know there are so many people pushing for more and more research, because that's exactly what the medical model, the traditional medical model does as well. But saying that, many of our therapies are already supported by a robust body of scientific evidence, right? So herbal medicine, for example, there's been so many studies that have demonstrated the efficiency of plant-based compounds on treating a variety of health conditions. You might even look at something like turmeric, for example, an active compound that has been used extensively. It's been studied extensively. There's so much research into its anti-inflammatory and antioxidant properties. They've had clinical trials and testing on reducing conditions like osteoarthritis or cardiovascular health. Echinacea's had so much research on it to showing that it does boost your immune function. It reduces your duration of a cold. Why have it for 7 days when you can have it for 3 or 4? It helps trigger your natural response. There are so many peer-reviewed papers, and I actually encourage that for consumers. I encourage that for myself. If I'm looking into something, I won't just take something as fact. I'll actually go in there and look at the evidence. There is so much evidence. And we can do that in any area of our life, Natalie. We can sort of look at something and go, well, I don't know if that's, scientifically sound enough. And you know what? Everything should be more scientifically sound. We should never stop researching. We should always be wanting to go, yeah, where's the scientific evidence for that? So if I'm using acupuncture, where's the scientific evidence? There's so much for it. Remedial massage, homeopathy, nutrition, all of these areas of natural medicine will have so much research into why it is used and in what parts of the body it's used and why. And we should continue to do more. So I'm all about that as well.
Absolutely. So, for listeners who are really wanting to explore natural medicine, what first steps would you recommend to help them get started?
I think it is wonderful that people are curious and they definitely want to start diving in there, but you don't have to think, oh my gosh, Annie said she's just represented 20 different modalities and there's probably more. Should I start just doing everything in my life? My first advice is to start with a really thoughtful and informed approach to your own health, right? So the field of natural medicine offers such a wide range of therapies and solutions, and you want to find out what's going to be useful for your own unique health goals and needs. So do your own research for one. Take some time to learn about different therapies. You can definitely go to the ATMS website, atms.com.au. You can learn about the different modalities, and that'll give you a snapshot from our practitioner's perspective. And start, doing your own research. Definitely listening to this podcast every fortnight. You're going to learn so much because we're going to be having guest speakers every episode with Natalie telling you about the potential benefits, and then finding something that you're interested in. So, for example, if you're interested in nutrition, you might just think of your own diet. Is it working for you? Is it helping you be healthier, stronger, less stressed, more balanced? Or actually are you going, you know what, I just eat on the run, or I don't really think about the nutrition in my food, or actually when I eat some things, if I drink a red wine, it gives me a headache, for example. You might want to actually start thinking, okay, well, I might want to book an appointment with a nutritionist, for example, there, or a naturopath, to actually start doing some basic health health assessments on you. So definitely, if you've got a chronic condition that's being managed, even if it is being managed by a more traditional medicine approach, that's why we're big fans of integrative health, right? So I'd encourage you to, you can still go and look at that condition that you've got, and still go and see if remedial massage might help you, if seeing a naturopath might help you, if seeing a nutritionist might help you. So you don't have to do all of them. I'm certainly not into that. I'm into, I'll listen to my body, and if I suddenly go, I'm feeling a bit tense at the moment, I might go and make that time to go off and have a massage, or I might actually go and make sure that I go and do that yoga class that I was wanting to do. If I'm suddenly just been eating on the run and now I've had 2 colds in a row or something like that, and I'm like, what am I doing? Is it the stress? Is it my lifestyle? Is it my diet? I might want to go and see a naturopath just to sort of take some time out to really assess, and they'll also do all the medical treatments, assess your blood and things of that nature as well. So I think the response from me, Natalie, is, be aware of what's available to you. Find out what interests you, then actually listen to your own body. If you're absolutely perfectly healthy, just keep being perfectly healthy. Well done, you. But you will have times in your life that suddenly, life happens. You suddenly get a bit more stressed, or you might be predisposed to a certain condition. It can just be because of genetics, could be because of something that's just happened, or your environment. It's so complex. So I think realize we're all individual. What happened with a friend might not happen with you. It doesn't mean that. So don't try and compare yourself against other people that you know. Go and see a qualified practitioner. We've got an opportunity on our website, Find a Practitioner, so you can find someone who's qualified, who does professional development, who is linked to health funds, if that's in your area. And so, you'll make sure that you see someone really reputable, and you will definitely be on a good path ahead.
Well, thank you so much, Annie. Such valuable insights, and for joining us on episode 1. Thank you again.
Oh, it's been such a joy to join you today. And thank you all for listening.
And thank you to our listeners for joining us. As I mentioned, first episode of Let's Talk Natural Medicine. So as Annie mentioned, if you are looking for a qualified practitioner, visit atms.com.au and click Find a Practitioner. Be sure to sign up to our Friends of Natural Medicine newsletter, wellness tips, recipes, and much more. So let's wrap up with your quick wins of understanding natural medicine. Number 1, explore holistic therapies that resonate with you. I really like that tip, Annie. Number 2, focus on lifestyle and prevention. And number 3, stay curious and open-minded about your health options. Until next time, take care and stay naturally well. Love what you heard today? Then hit the follow button to stay tuned for more deep dives into holistic health and wellness. If you're feeling the positive vibes, leave us a 5-star review. It makes a huge difference in spreading the message of natural medicine far and wide.